Imagine being told your pain is normal, not because any doctor examined you or because any type of test confirms it, but instead because you're a woman. Now, imagine waking up and missing so much school and work because your menstrual cramps hurt you so bad you could barely get up for the day. Or imagine waking up with a lump and realizing that you have to choose between paying for your doctor's appointment and your rent. Though these sound like random situations that I've just thrown at you, they are rare stories you come across. They are everyday realities for millions and millions of women across the world that consistently go through these barriers every single day. But I'm not here just to talk about women's health. I'm here to talk about something that honestly surprised me even more. Why are teenagers being the ones to truly take a call to action and discuss women's health openly while some adults still avoid the conversation? Because here's what I've learned. Healthcare barriers start way before someone even steps into the healthcare environment. They're built through silence, misinformation, financial barriers, transportation issues, and so much more to where we see a developed stigma around them. And teenagers? Well, they're the ones that are uniquely positioned to act on such an effect because they're the ones that are starting these conversations and they're the ones that are truly identifying the root cause. Granted though, if you had asked me a couple years ago, what is women's healthcare? I would have replied with a vague answer. Period cramps, annual checkups, pregnancy checkups. Basically anything that my health science teacher could cram into my head before that last bell rang. But the more physicians I interviewed, the more research I had conducted, well, the more I realized it isn't just one issue we're tackling, it's an entire system. A system where education affects confidence, where confidence affects whether someone seeks medical care, where research affects whether someone is able to identify the treatment required, and accessibility, whether someone even obtains the knowledge to know if that treatment works for them in a timely manner. And when one of these systems fail, the entire thing crumbles. And so I'd like to start off with one of the most prominent healthcare barriers of them all, information. According to the US Department of Health and Human Services, nearly 90% of people don't seem to understand basic healthcare information because of the amount of medical vocabulary embedded into it. 90%. Look at this room and think about it, because inherently what it's saying is that 9 out of every 10 of you walk out of your healthcare appointment confused about at least something. But let's be honest, we've all been there, where the doctor asks us, do you have any questions? And we all confidently reply with no. But then before we even leave the parking lot, we're searching up everything that just happened on Google and ChatGPT. And I'm also pressed for this issue as well because everyone else has done it. However, imagine doing that while also simultaneously translating every prescription, diagnosis, referral form, insurance form for your family because of the language barrier that you're being presented with. Because your family can't seem to understand, nor are they able to understand what type of language these prescriptions are being presented to them. And when people don't seem to understand the information, well, they delay their care. And they don't delay their care because they don't care about their own health and well-being, but they delay it because they're afraid of making the wrong decision. And that is exactly why I've started Project Horizon Health, a student-led initiative that is driven on promoting women's healthcare issues and overall enabling the accessibility around it. But I didn't start it simply because I believe information alone solves the healthcare barriers we're presented with, but instead, it does provide people with the confidence they need. And when people are presented with this confidence, well, now they're taking the call to action themselves on addressing these healthcare issues and understanding what's being presented to them. So now that we've discussed information, let's talk about opportunity. Though vague, let me explain. Imagine you're working your regular hourly job, your 9 to 5, and you feel an immense streak of pain, either in your head or your stomach, or you have severe nausea, and you know that you need to get a doctor's appointment, but you also know that if you get that doctor's appointment, well, then you have to miss work. And if you miss work, well, then you lose your income. And if you lose your income, well, now you're behind on rent. You're behind on utility bills. You can't pay for groceries, and now you can't support your family. And so you tell yourself, oh, wait, and you do wait. You first wait a couple days, which then turns into a couple weeks, and then it turns into a couple months. And then by that time, well, it's too late. Because what started off as a stage 1 low-risk condition has now transformed itself into a stage 5 high-risk surgery-inducing type of condition. And so many people are faced with this consistently. According to the World Health Organization, nearly 100 million people are pushed into extreme poverty because they aren't able to handle healthcare costs because of how expensive it's come to be. 100 million people. And when people are presented with these financial barriers, well, of course they'll tend to delay their care, as seen in the example provided. Because people are afraid of making, once again, that wrong decision. And it reaffirms an idea to why Project Horizon Health was even started in the first place. Because if we're even able to help one person find a low-cost screening program or a free healthcare clinic, or even provide any type of financial assistance, well, now they're one step closer into getting the care that they deserve. So now that we've talked about both information and opportunity, well, let's talk about one of the barriers that honestly surprised me even the most: opportunity and belief overall. When people aren't believed in the help that they receive, well, they soon lose that hope and they lose their mental health as well. And mental health, well, it's just as important as physical health, everyone. For decades now, women have been so underrepresented within clinical trials. And as a result, much of what we know about medicine, symptoms, medications, and prescriptions overall are based off of what's been conducted on men. And that gap continues to exist today. For example, take endometriosis, a word that honestly I didn't even know until a couple weeks ago. Women wait an average of 7 to 10 years just for a diagnosis. 7 to 10 years. Imagine your life in the last 7 to 10 years. And now just visualize it, Imagine living with chronic pain through it all while repeatedly hearing over and over again. It's probably normal. Pain doesn't become normal just because you hear about it often. Of course not, and pain come in various different ways and attend to various different aspects. But sometimes the best thing healthcare can provide isn't a prescription, nor is it a treatment. It's someone saying, I believe you. And I think that's where teenagers have started making the biggest difference of them all. Because once we're starting the conversations that so many healthcare systems themselves have avoided, we're asking the questions that people still find uncomfortable. And it isn't because we've simply stopped caring, but instead it's because we care so much. And waiting for someone else to start the conversation, well, it hasn't worked. And so we're starting it ourselves. Not because we believe we're more qualified, but because we're no longer willing to ignore that women's health is still considered a stigma and also seen as a taboo. My generation has grew up a lot around social media, so we've seen women openly express themselves about PCOS, endometriosis, iron deficiency, postpartum depression, infertility, and so much more. To the first time ever, millions of women no longer feel as if it's an individual problem because they see so many other people online going through the same thing, sharing their experiences and how their healthcare and their own symptoms were ignored. And when millions of people are viewing this, well, it starts to feel more like a community effort and one that is being understood by an international scale for so many people. Horizon Health started exactly for that reason. Just as I said before, we have seen so many people being affected on a consecutive basis. So through Horizon Health, when people are being exposed to the articles that we post where we're breaking down every one of these healthcare balances, as well as through the podcast that we publish to where we interview physicians where you can really face a virtual diagnosis, and through the amounts of people that are consistently volunteering or raising money for recently Alzheimer's patients and so much more, to where we can see a community effort being struck. History has shown itself in very past movements to where change is only conducted when people finally stop ignoring it and reject the status quo. And the same thing has happened today, except now it's a 16-year-old with a laptop and an idea. So I don't want you to leave this talk memorizing a statistic I said or an itty-bitty detail, but instead a question. What other healthcare conversations are you still waiting for someone to start? Because chances are they're waiting for you. At the beginning of this talk, I asked you to identify women whose pain was ignored. I don't want that to be a normality. I want that to change. So every one of you can get hand in hand and truly make an impact in your community through the barriers of opportunities that are being presented to you, whether it's addressing these barriers at its core or simply just helping people that you know, even if it's a stranger nearby. Because as a community, we can achieve so much more than what an individual can. Thank you.